Welcome learners. In the MOOC course Indian Economy, Policy and Environment, today we are in Module 4. The title of the Module 4 is Resources and Infrastructure, and in this module our today's topic is Unit 2, that is Social Infrastructure, Education, Health, Housing and Basic Amenities. So learners, let us begin with the introduction. So what is infrastructure at the beginning? So infrastructure is the essential services that supports, facilitates economic activities and enhances their productivity. So if we look at the Oxford Dictionary of Economics definition, it is the capital equipment that used to produce publicly available services including transport, telecommunication, gas, electricity, water supply and all modes of buildings and transport facilities. So within this infrastructure is basically grouped into two broad categories. One is physical infrastructure, the other one is social infrastructure. The physical infrastructures are basically the capital goods, mostly designed for or mostly used for increase in productivity. Whereas the social infrastructures are those infrastructures that are for improving the quality of life, and these social infrastructure are the pillar for overall human development in an economy. So, talking about the social infrastructure in India, so India is an emerging developing country, and the demographic dividend of the country made India's need for social infrastructure as a crucial prerequisite for inclusive growth, as India's policymakers tries to make an inclusive growth and employable country. Therefore, the quality of education, better healthcare and human development is the quintessential part for Indian economy. Now, how would we evaluate or assess the social infrastructure in an economy? So the basic way to evaluate the structure or the status of the social infrastructure is by way of expenditure on social infrastructure or by way of evaluating the outcome or achievement in the social infrastructure. So next, coming to the importance of social infrastructure in the development process. So it is well noted by various authors that social infrastructure in terms of education, health has immense importance in the development process. For example, education helps leading informed life and informed decision making in the process of the life. Better economic opportunities also comes through better education and better health, and it leads to better choice of economic options and lead to more productive way of life. It also empowers one in various ways, politically, economically and socially. Health education also make one healthy, which lead one more productive, and it also empowers one legally. So education and health basically empowers in all dimensions in life. Next, let us talk about the social infrastructure, the trend in expenditure in India. So if we look at this graph, we can see that the expenditure on health and education in terms of percentage to the GDP is very small, and if we look at the expenditure on education, we can see that post 1991 the expenditure remained around 3%, whereas in health the expenditure are on 1% and close to 2% by the end of 2024. However, if we have to compare the trend in the expenditure, we have to look at or we have to compare India in terms of some other countries. This table shows the expenditure on health and education with India vis-a-vis some other countries, say for example Brazil, China and some of the developing countries like United States and Switzerland. And we can clearly make the point that India is spending comparatively lesser amount on its health and education. Say for example, United States spent almost 10% of its GDP on health, whereas India spends only around 2%. Whereas in education as well, India spends about 3%, whereas countries like Brazil or United States spend more than 5% of their GDP. So if we compare the expenditure trend, we can say that India spends lesser amount on its health and education or overall social infrastructure development. Now, coming to the outcome on education, dear learners, we can see that India has improved in terms of literacy, which is the basic outcome on education. We can see that India had a very meager amount of literacy during its independence. It rose to 41% during 1981, which has improved to around 76% by 2022. However, you can see that during the same period, some of the neighboring countries or some of the Southeast Asian countries like Singapore has more than 98%, around 96% of their literate people in their country. So if we compare this, we can see that India is lagging behind. Moreover, if we look at the data, it's proved that in still more than 25% of Indian populations are illiterate. If we look at the male and female or the gender gap, we can see that about 30% of the females are still illiterate in India, while it is 20% for male. So the overall picture, although India has made considerable improvement over the years, but the comparative pictures is not very satisfactory. Dear learners, next, coming to the Government of India initiatives for education during this period. So Government of India has brought in several initiatives for empowering or for providing education to its children. Say for example, India launched Sarva Shiksha Abhiyan in 2001-2002, which the basic objective of the scheme was universal elementary education in the age group 16 to 14. Then the Government of India introduced the Right to Education Act 2009, which made the right for education as a fundamental right for all children in the age group 16 to 14. Then there is another initiative called Samagra Shiksha for giving a holistic approach for education in primary and upper primary levels. Samagra Shiksha Abhiyan includes Sarva Shiksha Abhiyan, Rashtriya Madhyamik Shiksha Abhiyan, and teachers' education together and named as Samagra Shiksha. Similarly, there is another scheme called Midday Meal Scheme, which was renamed as PM Poshan in 2021. The Midday Meal Scheme, the basic idea was to give midday meal for all children, all school-going children. The launch period of Midday Meal Scheme was 1995 for select blocks in the country. However, in 2001, all government and government-aided primary schools the Midday Meal Scheme was launched in all government and government-aided schools. And in 2007, the scheme was also extended up to upper primary levels. So these are the initiatives by the government by which the country is trying to increase its literacy, or basically to provide education for all children. So now, coming to the social infrastructure, what is the challenges in education sector in India, in primary sector, in primary education particularly? So the UDICE Plus report 2023-24 has given or has reported the available amount of infrastructure in schools in India. You can see that there are lots of infrastructural parameters where a school is assessed. For our class today, we are only focusing on three basic parameters. The first one is the electricity connection. The second one is the computer availability. And the third one is the internet facility. This report for 2023-24 says that about 8% of the primary schools in India does not have electricity connection. Similarly, more than 40% doesn't have a computer, and more than 45% doesn't have internet facilities in their schools. So we can say that the infrastructure in many schools are very poor in India, given the context of the present ICT revolution across the world. Dear learners, the next part that we are going to discuss is the challenges in the standards of social education in India. So there are several authors who have highlighted many issues or many challenges in the standards of school education in India. For example, it is often criticized that the school education in India is of poor standards. According to an assessment, it is found that after more than 4 years of schooling, only half of the children could read grade 2 level text fluently. Moreover, there is a lack of trained teachers in Indian schools. So these are some of the points which has been highlighted by many researchers about the standards of school education in India. In the next slide, we are talking about the achievements in the higher education. We can see that higher education institutes, the number of higher education institutes has gone up from 605 in 1950-51 to over 46,000 in 21-22. Similarly, the enrollment ratio has also improved from 1.5% to 28% during the same period. If we look at the density of educational institute in India, there are 30 higher education institute per 1 lakh population within the age group of 18 to 23. 18 to 23 is considered because this is the group that seeks higher education. However, we can see that there is a vast gap or vast regional gap in India. The graph in the slide shows that while Karnataka has 66 institutes per 1 lakh population, Bihar has only 7 institutes per 1 lakh population within that age group. The differences in the density of colleges also reflected in the enrollment ratio that can be seen from the graph. Now, in the health sector, let us look at what are the health infrastructure or the structure of the health infrastructure in India. The health infrastructure in India starts with, at the lowest level, the sub-health center, which is a health center for every 3 to 5,000 population. 3,000 population for plain area and 5,000 population for hilly areas. So this is the lowest rung of the referral pyramid of the Indian health system. It mostly provides preventive and promotive cares, but also sometimes it provides basic curative care to the masses of rural India. Every sub-health center should have one ANM and one health worker in that center. The next level health facility in India is the primary health center or the PHEs. The PHE, there are one PHE for every 20 to 30,000 population. It is the first one where there is one qualified doctor, and there should be OPD services for 6 hours per day, 6 days a week, and there also should be 24-hour emergency facilities in PHEs for next level referral. So one doctor is mandatory to be in the primary health sector, and there should be nurse, midwife, lab technician, pharmacist, and sanitary worker. That is the standard. That is the standard way. That is the standard guidelines for manpower in primary healthcare centers. The third layer is the community health center, which is for every 80 to 120,000 population, where this is the first referral unit in the health system in India. So in community health centers, there are OPD services with all the specialist services like general medicines, then obstetrics and gynecologists, pediatrics services, then dental, eye specialists. So all kinds of OPD services should be available in the community health services. It should have 30 indoor bed facilities with OTs and other X-ray and ECG facilities. So in the health structure, these are the three basic facilities that should be in the health system in India. Now, after looking at the structure of the health system in India, let us look at the availability of doctor, which is one of the basic parameter for assessing the health services in a country, and also the beds available per 1000 population. So you can see from the figure that the available doctor per 1000 population has improved considerably, and it has reached around 1 per 1000 population, which is a standard WHO guidelines. The World Health Organization suggests that there should be ideally 1 doctor per 1000 population, and India has more or less achieved that feat by year 2020. However, if we compare it with other countries, in the USA there are about 4 doctors per 1000 population. So we can have a comparison also that India, although have made considerable achievement, but the progress is not as comparable as some of the developed countries. Similarly, the number of beds, we can see that the number of beds is about 2 during 2001, which has reduced to 1 or 1.5 in 2020. So even that means India has less than 2 beds per 1,000, 2 hospital beds per 1,000 population. The same is 5 for China. That means China has 5 beds per 1,000 population. Again, in comparison, India's performance is very poor in terms of availability of doctor and beds per 1,000 population, although it has achieved some standard laid out by the World Health Organization. In this next slide, we are talking about some of the outcomes in the health sector in India. So we can see that in the table, we have shown that health outcomes like crude death rate, crude birth rate, total fertility rate, maternal mortality rate, infant mortality rate, life expectancy. In all these parameters, India has made considerable improvement over the years. However, again, if we compare these with other neighboring, developing, or some of the developed countries, the figures are not that satisfactory. Next, let us talk about India's health achievement in terms of immunization for the children. So we have considered 3 basic immunization, 3 basic vaccination, one BCG, then DPT, and the hepatitis B. Again, we can see that India's performance, although is very impressive during 2000 to 2003, but India's performance far lesser than what China has achieved or the many other countries. However, dear learners, you should note that, for example, in the European region, the vaccination for hepatitis B is very less compared to India or China. So, in this context, it is to remember that many regions or many countries do not recognize some of the disease as life-threatening or as important as some of the developing countries consider. So while reading these figures, one should keep in mind that the importance or focus on disease are different for different countries. In the next, what we are going to discuss is the achievement and challenges that India has made in social infrastructure. So if we look at in terms of achievements and challenges in the health sector, we can see that universal immunization program that was launched in 1985 and the mission Indradhanush in 2024, India has achieved the immunization up to 93.5% by the year 2023-24. It is considerable improvement over the past years. However, still almost 7% of the children do not get the basic immunization or basic vaccination. Thus, a threat always remains for their life. Then, if we look at across the states, according to 2023-24 report, we can see that there are a few states which have performed very poorly. For example, Dadra and Nagar Haveli has only 48% immunization, whereas Puducherry has 60%, Nagaland has 62%, Sikkim 65%, Rajasthan 76%, Arunachal Pradesh 79%, for a few examples. And now, it is important to note that immunization or vaccinations is a public good. It has positive externalities. So if one children remains unvaccinated in one part of the country, it causes or it remains as a threat to spread those diseases in other areas as well. So it is a grave concern or challenges for Indian government or Indian policymakers to ensure 100% immunization across the length and breadth of the country. However, despite these challenges, India has made possible eradication of some very life-threatening diseases. These are smallpox, which India has eradicated in 1980. Then Guiana worm has been eradicated in the year 2000. Then polio in 2004, and maternal and neonatal tetanus, which was eradicated in 2015. So, being a developing country, these achievements are impressive as India has successfully eradicated these diseases from the country. However, there are still threats from many diseases like malaria, dengue, then TB. These remains as a grave threat to the Indian policymakers in the health threat. For example, out of the total global cases, 25% of the TB cases are reported in India. Similarly, as we have noted earlier, the doctors' population ratio, hospital beds although has improved or comparatively has improved over the years, but in comparison to other countries, it's still very disappointing. Now, let us talk about other facilities like housing. In the housing sector, government has introduced flagship programs as early as in 1957. Under this scheme, loans to individuals are offered, and also loans to cooperative was also extended for building houses for housing scheme. Later on, the government of India introduced Indira Awas Yojana in 1985-86 with the purpose to provide financial grants for the construction of houses to the rural poor. This Indira Awas Yojana has been restructured and renamed as Pradhan Mantri Awas Yojana Gramin, which provides housing for families with housing to families below poverty line, and it receives financial assistance up to from 1.2 lakhs to 1.3 lakhs for construction of houses. There is another scheme called PM Awas Urban, which is a corresponding scheme for like PM Awas Yojana Gramin. PM Awas Urban Yojana aims at providing affordable rental housing to urban migrants and poor people in urban areas. The economic reform in 1991 has opened the door for privatization in education and health sector as well. So, if we want to assess, or if we try to assess the impact of privatization or the economic reforms in education and health, we have to look at the dimensions of privatization in education and health. So, of course, the privatization provides an alternative for public education. However, one should understand that the quality of private educations may not always comparable or may not always better in all the places. Similarly, private education is profit oriented, and it is basically unequal as it provides opportunity to only a privileged sections of the society. Thus, it is unequal in nature. Similarly, private education is not affordable for all. Likewise, private education there is always asymmetry of information in private schools because the management and the school authority has more information about the quality and system about the parents. Therefore, there may be selection bias for the parents. Lastly, it is exploitative in nature, particularly if there is a competition, the competition is less in the quality and other things. Similarly, the private sector in the health segment has also certain limitation in providing healthcare services to masses in countries like India. So, for example, private sector focuses mostly on secondary and tertiary health system. It neglects the primary healthcare services. One reason might be that there is a high price elasticity in primary but low in the secondary and tertiary healthcare system. To take 1 minute to explain what is what is primary and secondary healthcare system. In the primary, you have the basic healthcare services, whereas in the secondary and tertiary, you have specialized healthcare services with advanced techniques. So there is a high price elasticity in primary. So if you charge higher, people may not come to take your service. Whereas in the specialized case, that is in the secondary and tertiary, there is a lesser price elasticity. So the private sectors are more focused in secondary and tertiary healthcare services. Second, it is unaffordable for all the people. For example, a recent report suggests that per hospitalization cost in private hospitals is 7 to 9 times higher than the public hospitals. So, as it suggests, the cost is multiple times than that of the public hospitals, and thus it becomes unaffordable for huge sections of the society in our country. Moreover, the unpredictability of the cost in private hospitals also deters many sections of the society to seek healthcare services in private sectors. Thus, it is essential for government to intervene and regulate in a desired way for providing affordable healthcare services to all. Dear learners, now if we kind of provide or give a summary, we can say that there is a considerable progress since independence in terms of social infrastructure. However, if we compare it like compare with countries like Brazil, China, the development and other developed countries, the development is comparatively poor, and there is a wide visible gap in the achievement in the healthcare and education in our country. Privatization has brought in some alternatives. Yes, it is true that privatization has brought in some alternatives in the healthcare services and education in India, but it is not affordable to all. Thus, the equity in the society remained challenged if private sector education and healthcare services is relied too much. Thus, it is observed by many authors that government intervention is crucial in developing countries like India, where there is a huge sections of society with bare minimum. Finally, to summarize the entire unit, we can say that India has made considerable progress. However, we can say that India's focus during independence was in particular in education, where in the secondary and tertiary education, thus India did not focus on much on the primary sector, and thereby has created a huge has neglected to improve the primary education for the masses of the society, and thus it has affected the overall productivity in the economy. Similarly, in the health sector as well, India emphasized on immunization and other health infrastructure, but the progress is considerably good in terms of numbers of achievements and outcomes in many health indicators. But in comparison to some of the countries, the progress is not that satisfactory. Overall, in terms of social infrastructure, India has made substantial progress since independence. However, when compared with other countries like Brazil, China, and developed countries like USA, the progress is rather scanty. Although economic reform in the form of privatization in social sector has brought in some alternatives, it is often criticized for its inadequacy in providing equitable and affordable services to all sections of the society in a diverse country like India. Thank you.